In this video, we will demonstrate how to remove and reinsert the HoverMatt Single Patient Use Link. If the HoverMatt SPU Link becomes displaced, it may require removal and reinsertion for safe, effective use. 2 caregivers are recommended for this technique. In this video, we will be removing and inserting a HoverMatt SPU Link and HoverCover at the same time. To remove the HoverMatt SPU Link, tuck it under the patient as far as possible towards the side you are removing it from. Ensure the patient's straps are properly tucked under the mat away from the patient. Insert the air supply hose into the intake valves on the removal side opposite from where it has been tucked. The removing caregiver will grasp the HoverMatt SPU Link at one side. The other caregiver will turn on the air supply using the appropriate button for the size of the product being used. The caregiver on the turning side supports the patient at the hip and shoulder, keeping them on their side. The other caregiver will gently remove the HoverMatt SPU Link out from under the patient. Once the HoverMatt SPU Link is removed from under the patient, the caregiver will turn off the air supply and disconnect the hose. To insert the HoverMatt SPU Link back under the patient, use the log rolling technique. The patient should already be rolled on their side with the caregiver supporting them at their hip and shoulder. The other caregiver will gently tuck the HoverMatt SPU Link under the patient. Insert the mat to the center marks at the top and bottom of the mat to ensure proper placement. The patient's head should be positioned 2 inches down from the top edge of the HoverMatt SPU Link. Roll the patient to their other side. The opposite caregiver will support the patient at their hip and shoulder while the caregiver untucks the HoverMatt SPU Link from under the patient. Please see the additional videos for information on using the HoverMatt SPU Link for other patient handling tasks and techniques.